Dr. Charles Moak, founder of Allure Medical, is dedicated to helping you look and feel better. And he is here today to discuss what hormone replacement therapy is and how Allure Medical offers it. Thank you so much, Dr. Moak, for being here.
Thank you. So, hormone replacement therapy was pretty much standard of care until about 2000 when a study came out that suggested there might be some risks associated with the specific drugs we're using in the United States.
Yeah.
But in Europe and other countries, they were actually using hormone replacement, actual hormones, testosterone, estrogen, progesterone. And they were seeing a significant reduction in what we call all-cause mortality. So we think about longevity or living or health span.
Yeah.
You really want to not die of something totally preventable. And when women go into menopause, that's when a risk of heart disease, breast cancer, osteoporosis, neurocognitive decline, they go up substantially, precipitously. And we've known in the past that hormone replacement therapy reduced risks of those diseases, but it was abandoned about 20 years ago because there was some fears about a drug that was being used. And we really switched over treating hormone replacement, treating menopause from a hormone deficiency to a mental illness and substituted what we call SSRIs and antidepressant drugs.
Oh, wow.
Those were very, very infrequently used back in the 90s, and now it's about 25% of women are on them for menopausal symptoms. And now there's a big pushback towards things that are much more healthy, which is using actual hormone replacement. And I'll tell you, back in about 2002 to 2004, there was a couple things that kind of hit the news, and it really got doctors afraid of using hormone replacement therapy. One, they potentially cause breast cancer.
Yes, I remember hearing that, and it was just years ago before I didn't even cross my radar because I was like, I don't need that
Right,
yet.
so the dirty secret is the study on women on estrogen only, it was a synthetic estrogen, had a reduction of breast cancer versus women taking nothing. Totally misrepresentative and misrepresented basically in the big news and how we thought about it, and doctors were misunderstanding it. It was women that are on a drug called Provera that had a slight increased risk of breast cancer. No increased fatalities, but a slight increased risk. And that's not a hormonal, it's a drug. Second thing is there was a concern about risk of cardiovascular disease. Well, now we find out 20 years later, maybe 10 years later, they looked at the studies. Women who started on the synthetic hormone drugs within 10 years of menopause had a 40% reduction over the next 10 years of heart attacks and death from heart attacks or stroke. Now fast forward into 2020s, we have large studies in Europe where they were never using these synthetic drug pills for hormone, they were actually using hormones, commonly a patch or a pellet. And we see there was a large study, and a Danish study and a Finnish study with about 2 million women a year, so a massive study, showing that the longer a woman was on hormone replacement therapy, the more cardiovascular and stroke protection she had, and the longer she lived. I mean, it's more duration. Start it when you get into menopause or within 10 or 20 years of menopause. Take it longer, you'll have less strokes, less heart attacks, and less all-cause mortality. Testosterone, which is also hormone replacement therapy, reduce your risk of breast cancer by 40 to 70%.
Wow.
So, again, just a big, maybe a change in approach to women's health care that really affected a whole generation of women. But now the mood's changed. We're not afraid of it anymore. Doctors are learning how to learning more about it. And it does take time. So there's a big paranoia 20 years ago that's pretty much dying off, and we're realizing we should really be treating the problem, which is menopause is a deficiency of hormones, not a deficiency of antidepressant medicines.
Okay, well, these are obviously amazing causes. Let's talk a little bit of the vanity and weight gain. That's a big one for, menopause, all these unexpected pounds that just kind of show up. Does it help with that?
So that's, right now there's big interest in using these GLP drugs, which were fantastic, but menopause, the most common complaint is weight gain. And things is because of a deficiency in hormones. And women on hormone replacement therapy, not the synthetic drugs we're using 20, 30 years ago, but actual hormone replacement therapy, gain less weight or have a better ability to maintain their weight than taking nothing. It also can make your skin look better. There's studies showing that the effect of estradiol on your skin makes your skin thicker, a little brighter, a little bit more moisture.
See, you get it. We want all that. We want to obviously live healthy lives, so we also want to look good while we're
and feeling better.
Yes.
So the big issue, people come in because they can't sleep, they have a night flash, hot sweats, hot flashes, night sweats, and they can't sleep, and they're gaining weight, and they have joint pain, and hormone replacement therapy is able to address each and every one of those.
I love that. Okay, where can we go and get that done here? You've got offices in Greenville and Spartanburg?
Greenville and Spartanburg, and what's nice is there's a try it before you buy it program where you can go ahead and we use a little pellet, size of a piece of rice, goes into your buttocks. We numb you up first, you don't feel anything. Kicks in a couple weeks or so, and by about a month or two you'll really feel it. So you can go ahead and try it at no cost, and if you want to continue it, there's a membership, very inexpensive to continue it. Usually we do it about every 3 months for as long as you want to, but you potentially would do it the rest of your life because you'd want to continue to have benefits.
Stay feeling that way.
Well, and again, the studies have shown the longer you're on estradiol, in the skin, the longer your health span is and the less cardiac risk you have.
See, I love that, Dr. Moak. Thank you so much for telling us about this. You see the book that's right there. You can go to the QR code that you see on your screen. It'll take you right to his book. You can also order it on Amazon if you would like. Thank you, Dr. Moak with Allure Medical.